My son was struggling with PTSD, and he could not get his thoughts together. He had expressed to me that his brain was just so jumbled up. He was having sleepless nights. He couldn't get his thoughts straight, and he was self-medicating with alcohol. I, I, I talked to him almost every day, and I was at the point that I didn't know if he'd be around the next day to talk to him. I knew he needed help. And first of all, I was able to send him to a therapist. And that lasted a while, but it didn't seem to help him anything in any way. He just couldn't get any kind of relief. He still had the scrambling in his brain, and he was still drinking alcohol. So that's when I knew that we had to do something more. I had checked on putting him in some kind of recovery program, but being a teacher, a retired teacher, I could not afford that. There was no way, and he was at rock bottom. He was struggling just to pay his rent at this point.
I had a very close friend who had been struggling with their mental health for many years. They had chronic mental health issues and were going through all of the normal steps of going to therapy and trying different medications, and nothing was really working. And the doctors told them that what they really needed was to go to a residential mental health treatment center. And so I started helping look for options. I quickly found that, first of all, it's so hard to get information about treatment centers. You have to spend so much time on the phone. I had this giant spreadsheet with all this information, and it was really taking a toll on me, and I was not even in a mental health crisis. And I started thinking about, how do people who are in the midst of crisis navigate finding somewhere to go for help? It's so difficult. There needs to be some kind of comprehensive directory that's easy to access, that gives you quick information, that helps you find exactly what you need. While I was looking at all of these treatment options and realizing that my loved one might not get to attend treatment because they couldn't afford it, I reached out to my sister, Jessie Lubicher, who at that time was a therapist at a residential mental health facility. And I said, hi, I have this person I really care about who really needs to go to treatment. How can we get them in when we don't have the funds that it takes to pay the sticker price of treatment? And she basically told me that hundreds of people are turned away every day from mental health treatment because they can't afford it. And that was likely what was going to happen to my friend. And so together, her and I decided to start a nonprofit mental health initiative with the goal that people like my friend and like the patients that she saw getting turned away every day were able to access quality, effective mental health treatment no matter what their financial situation is.
Residential mental health treatment has had an immensely positive impact on both myself and my family. I have a sibling with some mental health challenges, and it's been really a wonderful resource, both for him to gain a little bit more stability during times when, he's had some more severe symptoms. And then it's also been a really great resource for our family to be able to connect with counselors and other families that are dealing with a similar situation to get support and really figure out how we can best support my sibling. Treatment can be extremely expensive, very insurmountably expensive for many people, but having access to that is literally the difference between life and death. It will change the course of someone's life. It will turn their story from a sad story with an ending that we really don't want to a story of hope and a story of, triumph over a challenge.
If MHI had been functioning when I was 26 years old, it would have been my go-to for treatment. And this is the solution for people who are in my same shoes. And I feel strongly that this is a life-saving organization. This is going to change people's lives in ways that you can't even comprehend. The butterfly effect of people getting well in treatment is amazing, and MHI is at the heart of that.
I don't know. I can't say I can't think enough to tell you how appreciative I am and how hopeful I'll be. I have faith that this is going to work for him. He just needed some love, and he needed to clear his mind. And this program that he's in, that you have given the grant for, has worked so well on him. He's back to his normal self, and I'm thankful, and I know I'm blessed. I'd like to tell you about what he's doing now. I get to talk to him about almost every day, and he gets phone privileges at certain times. Well, he loves all the programs, and he loves all the people there. Everyone is going through the same thing, and they understand each other. And this is something that he was afraid of. And after getting into it, he realizes this is what he needed. He needed people to understand what he was going through. He has he's already written a song and sang it, and one of the members at this program has backed him up on the guitar, and next session he's gonna rap. We'll see how this goes on the 12-step program. So he's just so happy. I don't know if I'm gonna get him out of recovery or not.